began after a bad case of viral meningitis when I was 5. They tried every anti-seizure medication, but I still had episodes every few months or so. No one's ever noticed before. They just think I'm thoughtful.
Are you driving?
I couldn't until laser ablation to my left temporal lobe 12 years ago. Between that and the Keppra, I've been seizure-free, cleared by neurology to drive and to work as an attending.
There's so much to unpack here, so let's talk about it. She says that she started having seizures after viral meningitis when she was 5 years old, which is believable because meningitis can damage the neurons and cause inflammation, and the injuries can persist long after the virus is cleared and create a chronic, hyperexcitable brain network that seizures can come from. In her case, the damage was in her left mesial temporal region, which is deep inside the temporal lobe, and this region is particularly vulnerable to injuries. She said that she was still having seizures despite trying many different anti-seizure medications, which tells us that she was suffering from what we call drug-resistant epilepsy. In these cases, I often tell people there are two things that we could do to improve seizure control. One is to take something out of the brain, or two, to add something into the brain. In her case, she did laser ablation, which is a procedure where we use laser to destroy the part of the brain that's causing people to have seizures. And once that part is gone, seizures become better controlled. And if people have any sort of seizures that impair their awareness or consciousness, like what she has, in a lot of places, there are restrictions on driving. So for example, where I live, it's 6 months. And every time a person has an episode, that clock resets. This is a good reminder of one of the reasons why vaccines are so important, because it can decrease the risk of someone developing meningitis or encephalitis from a viral infection, which can be debilitating for life. So far in my career, every meningitis and encephalitis from a viral infection, from COVID or flu or varicella or measles, are from people who are not vaccinated. I'm not saying this is her case, and vaccines are not bulletproof either, but proactive prevention is always better than reactive treatment.